in our houses, we all have water that comes from a water main, a bigger pipe that, is fed by a reservoir. But it's these bigger water mains that are these huge pipes, but then they break off into smaller pipes that provides water to each of our houses. Our heart is made up of individual muscle cells that are sort of like those individual houses, and we have big water mains, which are our big vessels, and those are the vessels that we can see on a heart cath. And so sometimes those big vessels might be relatively free of disease, but those smaller vessels, those individual pipes that provide water to each individual house or each individual cell might be blocked. And those we can't really image. And so I think for women, we have to be more aware of the possibility of smaller vessel disease. In fact, I was just at a conference in New York recently where we talked about that. And the reason why this is kind of important is because now we have a growing number of medicines that we can use to treat that. And so perhaps we can help our female patients feel a little better as well.
That's fantastic.
Yeah, it's pretty interesting. So, some of the advances in cardiology is they're coming rapid and they're just astounding what we can do now with medicines and also with newer technologies.
Okay, let's talk a little bit about rehab. We've got Ray in the control booth there that's been through. They're still going through cardiac rehab, and boy, he is fit as a fiddle. But how does that play a part in continued quality of life?
Yeah, that's another great question. Cardiac rehab is really important. And cardiac rehab is more for patients that have had some sort of cardiac event, whether it be a heart attack, whether it be a stent. Some people that qualify for it are even patients that have had pacemakers placed in or defibrillators placed in. Certainly anyone who's had bypass surgery should go to cardiac rehab. And the whole concept of cardiac rehab is that it offers a structured, supervised, safe environment for patients to exercise and get back on their feet again after they've had some sort of cardiac intervention. It's been highly recommended by the American Heart Association, the American College of Cardiology, and there's numerous articles that speaks to the benefits of cardiac rehab. In addition to helping them with their exercise and supervising their exercise, cardiac rehab can also play a number of really other important roles. So for instance, going over their medications with them, making sure they're taking their medicines, monitoring other risk factors or other risk parameters such as your lipid profile and your blood pressure. One of the things that we're very active with is smoking cessation. So if people were smoking before, to help them quit smoking. And so I think cardiac rehab can play a very important role in that. At Berger, we're really fortunate. We have a fantastic cardiac rehab program. The one area about cardiac rehab, though, that has always been a problem doesn't have to necessarily do with the patients or with the facility, but more with the doctors. And in fact, there's a lot of research that says that of all the patients that should get cardiac rehab, only about 1/3 of them get referrals for that. And so what it's pointing out to us is that we as providers really aren't doing our job in getting patients the kind of help that they need to get them back on their feet and again to help them live a good, long, healthy life.
That ought to be part of the prescription.
It should be. And so the interesting thing that we've started here at Berger is we're partnering with the McConnell Heart Health Center up in Columbus, and they do just really innovative things with cardiac rehab. They have a very unique approach to cardiac rehab, and we're going to start partnering with them. And so all of our patients that are in our county, we're going to try to get 100% capture of those patients. So 2/3 of them won't be falling through the cracks anymore.
Yeah.
And we're going to try to get them streamlined into our cardiac rehab program. We're going to try to build our program a little bit more too. And the other thing that I think is another fantastic opportunity to us is to participate in some of the research programs that they have. I have a big interest in research and a strong background in research, which I think is absolutely important not only to propagate medicine, but also to provide top-notch care for our patients that's sort of on the forefront of medicine. And so this gives us an opportunity to work with the McConnell Heart Health Center to do that.
That's good.
Yeah, so we're really excited about that. And again, this is something that when I talked with our administration here at Berger, they were 100% supportive of this. And so I think at least for the cardiac rehab program, we're going to be able to expand that as well too.
Yeah. What do you see for the future here at Berger Health Systems, number one, and generally in cardiology?
Yeah, that's another question that we could spend and I would love to come back and spend another session with you talking about some of these things. But I am really excited when I think about what we're going to be doing here in cardiology at Berger and for Pickaway County. And these are some things that we're working with Tim Coburn and the administration here. We can do this, and when I look at it, I actually look at it on multiple different levels. So more of a systems approach, more on an individual services approach, more on a specific technique approach, sort of as we talked about with the radial caths, and also with the stress test, but also on an individual approach. One of the big things in medicine is personalized medicine, where instead of having a patient come in and just fitting them into a particular hole, we look at them and we say, well, what is it specifically about your background, about your medical conditions, about your medicines that we have to uniquely address for you? And we're starting to do that in my clinic right now as far as looking at their genetic history, their family history, their medicines, and tailoring that. And we can get pretty sophisticated with that. So for instance, some of the newer tests that we can use for looking at your lipid profile, we can order those tests. They're a little more complicated, and these aren't tests that are done everywhere, so we actually have to send them to other places across the country. But knowing that, we can more specifically tailor the therapy for each individual person.
Yeah, for the patient.
For the patient, yeah. So I think personalized medicine is going to be a big thing. As far as like some of the things that we're doing here at Berger Hospital, I think we're going to continue to increase our services. And so we're going to be increasing the number of procedures, diagnostic procedures we can do. So another example of that is for patients that come in with heart arrhythmias, or for people that come in with syncope, which is they all of a sudden fall out and they don't know why. We have a huge number of things that we can do to test for that, but a lot of times those tests end up being negative or inconclusive. And one of the procedures that I'm going to start doing here is called an implantable loop monitor, where we can implant a device that's literally about the size of a thumb drive right under your skin, and it can stay up there for a long time, up to 3 years. But it basically monitors your heart constantly. Instead of before we'd have patients wear monitors, which is a little cumbersome. They don't like doing it. It really inhibits their ability to live life. But this is something that is a little less cumbersome. It's a little more invasive, but not too much more. And I think this will really help us diagnose electrical heart problems or arrhythmias for our patients.
That's good. Well, Dr. Gregory Lamb, how does the community get a hold of you, and where do they find you at Berger Health Systems?
Well, so my office is right here at Berger Hospital. I'm here full-time. The only day that I'm not here is Thursdays because I'm doing research up in Columbus there. But our office is in the first floor of the medical professional building. Mm-hmm. And they can call us or they can contact me. I actually encourage people to swing by the office just to say hi, mm-hmm. and to introduce themselves to us, to my staff, and to myself as well, too.
Fantastic. Thanks for being on the show, Dr.
Thank you so much. I appreciate it.
Dr. Gregory Lamb, new cardiologist out at Berger Health Systems. And we're looking forward to good things, and hope I don't have to go visit for anything other than to say hi. This is John on CGTV5, and we'll see you next month on Burger Beat.